This episode of the Athletic Potential Podcast, we will be discussing how long it takes to return to sport following a muscle strain, as well as our go-to low back stretching exercises. Welcome to the Athletic Potential Podcast, your place to come and get answers to your athletic development questions. We cover a range of topics, all related to helping you to achieve your athletic goals so that you can experience and enjoy the athletic career that you deserve. I am your host, Dr. Mike Matthews. Hey everybody, and welcome back to the Athletic Potential Podcast. Excited for you to be here, and we're excited to answer your questions again. And just a brief update, here at Athletic Potential, we're starting to transition into in-season mode, which is you'll see a theme to some of these questions. And one of the things I wanted to bring up prior to us getting into these questions is really when we start seeing the transition from off-season to in-season, there seems to be a slight increase in our injury rates as they go up. And I did not have this question posed directly, but it's a question that was asked a few podcasts ago, and I just want to cover it. A lot of people always kind of come up to me and ask me, is like, hey, is the reason why people get injured in the beginning of a season because they didn't have a good off-season? Or is it something else? And realistically, I don't know how to answer this question directly without saying it depends, right? I mean, all things come down to really it depends. And that is what we've found is that those that take the time in the off season to take care of themselves and to get strong and not only to get strong, but get mobile if they need to get mobile, or essentially take the off season serious. Yeah, I would say that we see a reduction in the chances of them becoming injured in the beginning of the season. Now that doesn't mean that they won't get injured. It just means they have less chances of getting injured, or their likelihood or percent chance goes down. We can't fully prevent injuries, but we can definitely reduce them or decrease the likelihood that they will happen. And so as we go into season here and as we're transitioning here at Athletic Potential, I think what we're seeing now is questions of, okay, what happens if we get injured? How fast can we get back to sport? And that is essentially what these two questions are going to be talking about today. And I wanted to preface that with this, and it's more of a soapbox type thing for me, but I wanted to discuss it very quickly. And that is this: if you took time in the off season and you took it serious, it doesn't mean you won't get injured in the season. But what it does mean is that if you do get injured in the season, specifically at the beginning of the season, typically the rehab and the time it takes to get back is substantially less. And that's because the strength work's been done, the mobility work's been done. You gradually improve or increased your activity back to the level of where you're going to be playing your sport. And what we find is that those that get injured that did not have a good off season, typically they take quite a bit longer to get back. And so I can't stress it enough. The off season is a big deal. And if you don't have an off season because you're in a sport that just doesn't really ever take an off season, that doesn't mean if you don't have a true full off season, doesn't mean you can't do things to help improve your athletic abilities as well as decrease the chances of you becoming injured. But it definitely takes you being very much more proactive about your approach towards your sport. And so I know that we had a question a while back. I think it was actually not on the podcast. It was a client of mine, and they said, look, my sport's 12 months. I'm constantly playing. I never stop playing. And I said, do you ever have a month, maybe a 4 to 6 week period where you really significantly reduce the amount of competition you're playing in? And they did. They had about a 6 week period, and I said, that's your off season. During that time, you need to take care of all the things that you feel like are nagging at you. And that's what we did. And I can tell you right now, her 6 week off season where she was still practicing like 3 to 4 times a week. They had scrimmages, but they weren't, heavily intense and competitive. And to be honest, she actually went limited minutes in the scrimmages just because she felt like she could, and the coaches wanted to get a few other girls in. Spoiler alert, this is girls soccer. But anyways, they took that 6 weeks serious, and what we found is that even in that little 6 week time period where they're still on the field and running and cutting and all these type of things, we were able to work on a lot. And actually, as of right now, I mean, we're months out of this time period where she took 6 weeks off. She's doing fantastic, better than she was in the past. She's faster. She scored more goals as of right now. That maybe just be with her getting more opportunity, but at the same time, like, she's better, and the coaches are noticing it. And so even if you don't have a true off season, and you'll hear me say it, it doesn't matter. Like, there's times where you can dedicate to really improving just general strength, general mobility, and balance, those type of things. So if you ever have any questions about that, we're happy to help here at Athletic Potential. Just shoot me an email, mike@athletic-potential.com, if you do have questions on that, and we'll walk you through an off-season program, even if you don't have an off-season. So anyways, let's get right to the questions. Our first question comes from Nick. And Nick asks this question: how long after a muscle strain or injury is it appropriate to return to sports, lifting, speed and agility training? ? Oh, Nick, there are so many variables that I need to know here, and it's going to be very difficult for me to help you directly with this one, Nick. But I can tell you this. It really depends on how active you were before the muscle injury. I don't even know what muscle we're talking about. Maybe it's a leg injury, maybe it's an arm injury, a muscle in the arm, muscle in the leg. I mean, we could be talking about a back, I don't have a lot of information, Nick, but the reason I didn't reach out to you and ask for more information is because I feel like we can still get a lot out of this. And so let's just say muscle, right? I believe it was like episode 1 or maybe not 1 or 2 or 3 of the podcast. We talked about how do we know as rehab specialists how long it takes for someone to get back. And one of the things we talked about is we have to know what tissue has been damaged. Okay. And when we talk about tissue, we talk about bone, ligament, joint, cartilage, muscle, nerve, that kind of thing. And we have some research that would indicate how long it takes for certain things to heal. And that kind of gives us an idea of how long it takes to return. Now, that being said, when we're talking about muscle is one of those, it really depends, right? I mean, we've already talked about it. It depends. So let me tell you this. If you have a high grade muscle strain, we're talking, really nasty tear, bruises out. It's you can't even, touch it. It hurts so bad. That kind of stuff. It's just going to take a long time, right? And when I say a long time, for those that have been around me long enough, I measure everything in a little bit general, but let's put it this way. I measure whether it's going to take hours. I should say minutes, but I don't think I've ever measured anything in minutes in regards to somebody getting back in regards from an injury. But let's just say hours, days, weeks, months, years. And, if so somebody says like, hey, I'm going to have Tommy John surgery, I tell them it's a year, right? Or we could even go to months and say, hey, it's 12 months, 12 to 15 months. Hey, I'm having a arthroscopic surgery of my knee to fix some frayed cartilage in my knee. How long is that going to take? 6 months. And we give it a time frame, and 6 months is relative in regards to the cartilage side. Is a bad example, but we give it based on the tissue. We can basically say, look, it's going to take about this amount of time for you to return to your sport. Now, again, it depends on your sport and what you're playing and what you're trying to do. And I mean, is this collision sport? Is this curling? Where we're probably able to get you back a lot faster because it's just not high impact. Yeah, you got to work through very controlled movements, those type of things. Is it baseball? You're trying to throw a baseball again, football, taking hits and cutting, those kind of things. So all those things play a role. And so, Nick, to try to answer your question, basically what I would like to do is kind of give you the framework of how we do that here at Athletic Potential. And that is, look, first and foremost, we need to stage the injury and what tissue is involved. So when did it happen? How bad is it? And what tissue are we talking about? Now, in your case, maybe we just kind of make up a hypothetical, okay? So one of the most common injuries that we see in muscle, really at this time of year, and that is hamstring strains. We see hamstring injuries all the time. And so let's talk about hamstrings. So say, Nick, you pulled your hamstring, strained your hamstring, let's say it happened 2 days ago. It was grade 1 or 2, meaning not terribly bad, but you definitely knew you did something to it. And now we know it's a muscle, right? And we are able to identify it as a muscle in a clinical exam. And we look at it, and I can tell you right now, Nick, it happened 2 days ago. It's a grade 2. Well, let's just say it's grade 1. You can feel it, but you can walk on it. The pain's like a 3 out of 10 when you walk on it. And it's muscle. We know it's muscle for sure. I can tell you right now that my goal for you, if you're, say, I shouldn't say track and field. Let's just say a tennis athlete or an athlete that isn't playing collision sports, does require cutting and acceleration and deceleration with a hamstring. So let's just say tennis, right? So you're a tennis athlete, you tore your hamstring, it's a grade 1. It happened 2 days ago. I can tell you right now, my goal is to get you back on the tennis court realistically in the next anywhere from 14 to 30 days. So essentially, 2 weeks to a month. That is my goal to get you back. Okay. Now, I definitely have seen rehab faster than that, but I've also seen it quite a bit slower, right? But in a hamstring strain grade 1, I'm seeing you 2 days after the injury. Yeah. And I know it's more in the muscle. That's kind of my time frame. Now, Nick, that again, your mileage may vary here in a lot of different ways based on how bad it is, where it is, that kind of stuff. But that's where I start. And then from there, I build a program, kind of build it backwards. And so if let's do a very specific. All right, 20 days from now, I want you back on the tennis court in competition. Okay. So 20 days from now, that's what I want. So I need you practicing, 5 days before that to make sure everything's good. So now we're at 15 days. 5 days before that, we need to be having you sprint back and forth, doing all sorts of deceleration, cutting, agility type drills. So now we're 10 days out, and then 5 days from now, essentially, like 5 days, I need you to be able to do a full on hamstring curl, no pain, to be able to do a straight leg deadlift, no pain. And you got to be able to show me you can jump in that time period from 5 to 10 days. And then, by the way, from 5 to 0 days, which is essentially now, what I really want to see is full range of motion, no pain with walking, no pain with a normal unweighted straight leg deadlift. When I say deadlift, it's a hinge, okay? And you got to be able to go up and down stairs without pain, okay? So that's what I want to see. So now I've got my treatment figured out. Now the key is whether or not your tissue is ready for that kind of load. And we're only going to know that through a couple different ways. Now, for those that listened to last week's podcast, I kind of had a little rant about how we stage an injury. And this is where that comes into play. That we stage an injury based on pain first. Second, we stress test it. It's typically like hands-on, push, pull, maybe some testing of muscles, range of motion, that kind of thing. And then the third thing we do to stage an injury is to field test it. Okay? So, Nick, say you come in, it happened 2 days ago. I take a look at your hamstring. I say, hey, look, I saw you walk in. You weren't limping. What's your pain? Hey, it's a 3 out of 10 normally. Okay, let's, that's good. We want 3 out of 10 or less. That's what we're looking for. Great. Here's what we're going to do next. Now what we're going to do is I'm going to go poke, prod, test, pull. Essentially what actually we'll do a lot of times is actually strength test it with numbers. So we actually know exactly how much you're pulling, healthy leg versus unhealthy leg at this time, okay? Or affected versus unaffected if you want to be politically correct. But anyways, so we test it that way. And lo and behold, you test and your stress test fails. You are not strong enough. It goes above a 4 or above in your pain. And so I know that's where we're at. Okay. And so I spend the next however many sessions that I need to, hopefully within the next 5 days, getting you to the point where I can get your hamstring to be the same strength as your unaffected hamstring. So the hamstring you tore to be the same as the unaffected hamstring. By the way, this works for biceps. This works for rotator cuff. This works for butt. This works for calves. Okay, just so you know, not perfect time frames, but this is the same routine. And then once we stress test it and you test fine in the stress test, I'm going to take you to the field. The field test is pretty straightforward. Can you run from here to there and not have pain, or pain levels are 3 or less? If you can't, then that's where we're at, and we build up from there. So, Nick, to answer your question, how long after a muscle strain or injury is it appropriate to return to sport? As soon as you can get back to that sport after passing the pain test, the stress test, and the field tests. By the way, there's another test, and that is the return to sport test. That means you got to be able to go back and do a full-blown practice, preferably like a scrimmage. It's essentially competition without any consequence for losing, right? So that's a scrimmage. That's in baseball, it's live ABs. for pitchers. They're pacing hitters, but it doesn't matter if they get a hit or not. That kind of thing. All right. You've got to show me that you can do that. Now, if you can't do that because the pain levels are high, we go kind of back down and figure out, right, well, this is where you're at. We're not there yet. Okay. And then we see where you're at. And that is typically how we figure out how fast we can return our athletes back to their sports. Now, I will tell you this. There are things that we can do as rehab clinicians, and it's something that we're bringing online here at Athletic Potential that I'm hesitant to talk about. I really am, because I'm not there yet. But we've seen some results, and we're starting to see our preliminary results with a new treatment methodology and a new treatment protocol for certain things. And we are starting to see some results that are cutting significant time out of the return to sport for our injured athletes. And I'm pretty excited about it. It's something that I was exposed to a couple of years ago. I know I'm teasing everybody, but I don't want to talk about the name or anything, or really until it's full-fledged and going. But I can tell you right now, we've got some cool stuff in the works at Athletic Potential that is getting people back way faster than we've ever seen. So, but anyways, if you do have a muscle strain, and this is what I was getting at, Nick, if you have a muscle strain, you can do it on your own. You can. It'll automatically... Okay, I'm going to just throw a number out there. So I may be way wrong on this, but I'll be honest, I don't think I'm that far off. If you do this on your own and try to just kind of milk your way back and rehab your way back on your own, you're going to double the time it could take. I'd honestly say maybe even more, double or more the time it takes for you to return to sport. Then if you would just invest in the time to go into a qualified rehab professional who will then build the program out for you and progress you back to your sport. And because let's be honest, my job, and this is something that John, if you guys, I introduced John in the last episode, not actually on the podcast, but just I have a student who's a full-time student, and he's fantastic. And this is what I tell him, like, look, what is our job as a physical therapist or rehab specialist? Our job is to essentially get our athletes back as fast as possible, but make sure that they stay as healthy as long as possible at the same time, right? And so we're always pushing the limit between if we go too hard and too fast, then we essentially re-injure, re-aggravate or re-injure what we're trying to get the player back from, right? So in this case, in our example with Nick as a hamstring, if we push it too hard, too fast, we could re-injure the hamstring and we kind of start over again. But we don't want to be so conservative that we lose out on potential time that athlete could be participating in their sport. And that's just being too conservative, right? Nick, you do this on your own, you're going to be too conservative because you're not going to be very sure about your decisions to push forward, or you're going to be too aggressive and you're going to re-injure. But either way, our job as rehab professionals is really to get our athletes back as soon as possible, but also with the mindset of that we're going to have them stay as healthy as possible. Okay. And so Nick, you can't do this on your own. It won't go as well as you'd hope for. You'll never know if you never go to the rehab specialist, but what we know as rehab specialists that it's going to be a significant less amount of time to get you back to your sport. So if you're dealing with an injury, Nick, find a qualified health or rehab clinician, and they will help you. Okay. If you don't know if you have one, or if you're concerned that you've already been to one and they haven't helped, reach out to me. We definitely do remote coaching. A lot of times, actually, I'll find a qualified clinician in your area for you. So just depends on where you're at. Anyways, reach out to us at Athletic Potential. We're happy to help. Okay. But good question, Nick. And I love the question because, again, it sets up a protocol. It sets up a system that we have to use. And if you follow these systems, you're going to get very predictable outcomes. So thank you, Nick. All right. Next question. Josh says, or asks, what are your go-to stretches for low back pain? I have been dealing with a sore low back for quite some time, and none of the stretches I have found, in parentheses, he's got YouTube, okay, and have been shown, PT, have been effective long-term. So you saw some short-term effectiveness. Okay, that's good. Love your insight on this. Josh. Okay, I can tell you right now, Josh, this is something that I probably could, again, spend a whole podcast on. But realistically, let me just tell you this. When we're talking about low back pain, Josh, I don't know. I don't know your age, don't know the injury, don't know how it happened or anything like that. And all those things play a major, major role in regards to exercise prescription and those type of things. But I can tell you this. and I'll generalize this, and I know I'm going to get somebody who's going to be like, yeah, that's not true. If you have this, then you should be doing these stretches. But yes, that is true. If you have a very specific injury, this a stretch will help it. But let me tell you something about low back pain and the treatment methodology that I've been using for quite some time that has been by far the most effective thing I've seen in regards to low back pain that's coming from a mechanical issue. Mechanical means that you got a disc problem, you got a joint problem, you got a nerve that's being pinched because of a lack of space where the nerve comes out of the back, you've got a bone problem, you got a ligament problem, those type of things, muscle strain, all of those things would be mechanically based low back pain. And now that's my avenue. Okay, there's other causes of low back pain, but realistically, that's a lot of what most people with low back pain have. That's a lot of what it is. Now, let me tell you this, Josh. I've been a clinician for 14 years. 14 years. Coming up on 14, sorry. And I stopped stretching patients with low back pain about 10 years ago, 9 years ago. Actually, less than that, or more than that, 11 years ago. 11 years ago, I stopped stretching patients with low back pain. And here's the deal. This is what inevitably would happen, and it sounds like this is what's happening with you, Josh, is I would stretch them. They'd be in clinic. I'd do some stretches. I'd work their back around. They'd get up and like, oh yeah, my back feels a lot better. I'm moving around a lot better. This feels good. And you walk around and like, oh yeah, I still feel pretty good. And I'm like, no pain at all. They're like, no, still got some pain, but it's half of what it was. So instead of a 6, now it's a 3. Fantastic. Great job. Here's some exercises. I need you to keep doing them. Go. And they'd leave the clinic and then they'd come back, anywhere from, normally 48 to 72 hours, maybe 4 days later. And they'd look at me and be like, dude, my back pain's back. And I'm like, same level? And they're like, it's a little better, but to be honest, it's still there. And then I'd be like, okay, I need to know how you felt 24 hours after my session. And they'd be like, oh, my back pain was back by then. I'm like, oh, okay, hold on. How long after my session did your back pain stay down or stay away? And they said, it lasted really until the end of the day, which was about 5 to 6 hours. But then it seemed to come back, or a lot of times they'd come to me later in the day and they'd go go home, feel good. They'd go to bed, and then they'd wake up in the morning like, my back pain's back again. And so I started realizing that they were only getting better, or only feeling better once I was done stretching them. And once they left, and really this is actually in it didn't matter what exercises I gave them, they still didn't feel better after the stretches. So I decided one day, can't tell you exactly what day, I just remember seeing a patient with low back, and I'm like, oh, you know what? Like, I should be doing, these knee to chests, and I should be doing these like rotations, and I should be stretching them, and I should stretch their hamstrings, because, everybody has low back pain, has tight hamstrings. And so I said, you know what? I'm just not going to do it. Just not going to do it. I'm going to put heat on them. I'm going to put electrical stim on them to help with their pain. And then all I'm going to do is teach them to do exercises where they teach their core to brace, meaning like your abs and your obliques. I teach their core to brace. And then the next thing I'm going to teach them is that when they go to sit and stand, they don't arch their back to stand. They don't flex their back to sit. And that's all I'm going to work on. And I'm going to see if I see any difference in my patients. And I'm not going to lie, I was so frustrated with myself that I just did that with the next 2 low back pain patients. And guess what happened? Their pain didn't come back for a 72-hour period. And I'm going, you got to be kidding me. They come back and I'm like, I didn't stretch you at all. And how do you feel? My pain is still 50% of what it was since I saw you last. I'm like, I didn't stretch you at all. Not one bit did I stretch you. And you're better? That's weird. And so then I said, you know what, fine. Like, okay, let's just keep going with this. Did some new exercises, tried to get them to, essentially not only sit to stand, but hey, if you're going to do the dishes, you got to do it this way and keep your spine in a neutral position. And okay. And also what I'm going to have you do now is I'm going to have you pick up a weight. You're going to carry it on one side, light, like 10, 15 pounds. I'm going to have you carry this 10 to 15 pound weight for like 20 to 30 yards. You're going to switch hands. You're going to come back, and you're going to do that in addition to the other exercises I've already shown you. And guess what? They'd come back the next week and they'd say, hey, my pain levels are still lower. I was at a 7 when I first saw you. I went down to a 4 or 5, after that. And now I'm in a 2. And I'm going, man, I have not stretched you one bit. So then I ask them, hey, have you been doing stretching on your own? And they're going, no, I haven't. I just did what you did. I'm like, or you told me to do. And I'm like, oh, fantastic. I'll be like, it's great. Fantastic. Let's just keep doing these exercises. And they'd come back to me the next time, a lot of times, not everybody, but it seemed like there was a trend. And they'd come back to me upon their next visit, and this is what they'd say: my pain's back. And I would look at them like, why? Why is your pain back? Tell me, did something happen? Did you lift something? Did you carry something? Did you sleep funny? Like, tell me what happened. Oh, you know what? Like, I've been doing these exercises, and what I've noticed is my muscles, they feel tight and stiff. And so I started doing some stretches for my muscles. And I'm like, well, what did you do? Oh, I did some knees to chest, and I did some scorpions and side to side rotations. And I went back to all the stretches that I was doing with patients when they were hurting. And guess what? Pain returned. Josh, long story, and the reason I bring it up is this. Let me tell you this. Most spines, no, you say low back, so sorry. Most low back or lower spines are not built to move, okay? Yes, they have range of motion. They can flex 60 degrees. They can extend 30 degrees. They can rotate a total of like maybe 30 degrees. Really, some studies say 18, so hardly anything. They side bend anywhere from 45 to 60 degrees depending on the person, right? So yes, they have range of motions, and yes, they can move. But if you look at how the muscle fiber types of the lower back are built, if you look at their orientation of the muscle, meaning how they're put together and at angles and those type of things, if you look at those things in the lower back, and you look at how the joints work, and you look at how the ligaments work, and you look at how the bones are set together, that whole area is not built to move. It's built to control movement. Okay? So, and I wish I had a good example, right? I mean, you look at another joint, right? And you look at our shoulder. Our shoulder is built to move. It's a ball and socket. It's got crazy range of motion. You can put your hand behind your back. You can reach behind your head. You can reach, all around. It's got this crazy mobility, and it's actually built to move. It's built to go to its end range of motion. Our lower back is not built to go to our end range of motion. It's meant to stay within its range of motions. And what we're doing when we're stretching is we're taking it to its end range of motion. But not only that, then we're stretching it maybe into a little bit more. It doesn't like being there. And so then it gets cranky and sore and upset. So Josh, I think that's the reason why you continue to have a sore low back after doing your own treatments with YouTube. It's fine. I get it. Definitely done it myself and a lot of different things. But realistically, and the PT that showed you, I don't know what stretches the PT gave you, and it doesn't really matter, but if they're doing any type of stretches, which is what you're referring to, I would argue that you're probably not doing the right things. And I don't just say that because, all stretches are bad with low back pain, but I can tell, well, it hasn't worked. You said it hasn't ever been effective long term. So one, those stretches aren't working. So I don't know if you need the right stretches, Josh. Profound statement, here it comes. Maybe you just need to stop stretching. Totally. Let me do a little self-experiment. For the next 48 hours, Josh, no stretching, period, of anything. No stretching. Okay? If at the end of the 48-hour period your pain levels are the same, okay, continue for another 48 hours, no stretching. If at the end of the initial 48 hours your pain levels are worse, I want you to introduce one stretch. Just one, John, or Josh. Sorry, I keep saying John. I have a student. Sorry. Josh, one stretch after that first initial 48-hour period, okay, and see what happens. Your pain levels better get better. If they don't, you stop that stretch. Anyways, that was ahead of the game. Okay, now, if at the end of that initial 48-hour period, your pain is less, you do not need to stretch at all. You don't need to stretch. Don't stretch. You know what you need to do? You need to teach all the muscles that are surrounding your core, abs, obliques, erector spinae, to some degree the muscles above and below that. You need to teach all of them to control your spine within its range of motion. Okay, go to my YouTube channel, Athletic Potential. Okay, just go to my YouTube channel and look up Big 3. Okay, I can tell you what those exercises are right now. Curl up, bird dog, side plank. If you do those 3 exercises just right there, okay, those 3 exercises are going to help you. Okay. Now, even if at the end of the 48-hour period your pain level is the same, or maybe say it's worse, I would still encourage people not even to stretch at that point. I would just do the big 3. Hey, go do these 3 exercises. By the way, the big 3 exercises are not mine. They're Stuart McGill's. Okay. He's a very big time back researcher. Used to be out of the University of Waterloo. Fantastic research that he's put out and information he's put out. Okay. I'll plug his book. His book, Back Mechanic, is fantastic. It's built for everybody to read and to kind of do your own self-assessments, those kind of things. It's a great start. Okay. He's got other books for performance specialists and rehab. They're fantastic resources. Okay. Stuart McGill, Back Mechanic. Anyways, moving back, just do those big three after that initial 48-hour period. If your pain is the same or worse, just do the big three. Don't even stretch and see what happens. If your pain level does not change or continues to get worse, you need to see a clinician. You need to see somebody for it. And Josh, it sounds like you've seen somebody. You need to see somebody else. Okay. Reach out to me, reach out to somebody. Let's figure this out. Okay. Let's figure this out. You don't need to stretch. I don't think you need to stretch. And those that are listening that have low back pain, I do not have my low back pain patients stretch. Period. Now, if you look at my YouTube, you're going to see things like hip flexor rocking. It looks a lot like a stretch, okay? But it's not really a stretch. And by the way, we're not stretching the lower back. Hip flexor rocking, that would be one. Hip adductor rocking, also on the YouTube channel. That's also another one that I usually give to our patients that are dealing with lower back issues. Quadruped rocking is where we start everybody with movement that is dealing with lower back pain. Okay? Those are great little things that you can do, and you'll notice when you do these things, we're not stretching the back. The back is actually staying in a very neutral position, and that's what it needs to do. Here's the coolest thing. One of the things that blew my mind, and Josh, I'm going a little bit off on a tangent, and I apologize, but let me just tell you this. We were taught in school. Now, I shouldn't say that. I don't know if we were taught this in school. I have a hard time remembering, but at least what I came out of school with, whether I was taught this or I just picked this up from somewhere, is that if you have a disc problem, like a herniated disc, like a disc bulge, you're stuck with the thing. That's just what it is. If your discs are flattening, you'll see it on x-rays. Have you ever heard of this, like degenerative disc disease? It's out there. That's what you hear. Okay. If you got that, you're stuck. Your discs are going to just eventually just going to wither all the way down to nothing. Bam, you're going to be bone on bone in your joints, right? Or in your back. I blew my mind. This is part of McGill's work. Okay. Your discs in your back can heal. They can heal. Now, not all conditions heal, but they can heal. And the crazy thing is, you know what they need? Time and rest. Okay? Now, a lot of people are like, the only way to rest the back is to like lay down and never move again. And I go, yeah, that's terrible, right? Bed rest has got its own major problems. We don't really want bed rest, but I can tell you this right now. That's not what I'm talking about. We're talking about they'll heal if they're able to rest or decrease the amount of stress they're getting. Guess how you decrease the amount of stress in your back besides getting in a pool? You teach the muscles surrounding the spine to hold it within certain range of motions and to keep it in a very neutral position. Okay? That does two things. Decreases the stresses that go through the disc in different directions. Okay? And it allows the disc material to not go out in the bulge. It actually will allow the disc material to come back in. Okay? That is, and not all disc bulges come back. You know, they call it a dynamic disc bulge if it does. These are nuances. Look, your discs will heal, but here's the thing you have to do. You have to let them heal. So Josh, I don't know if you're dealing with a disc injury. You're just kind of cranky low back is what you're talking to me about right now. But I can tell you right now, if you stop stretching and you teach the muscles surrounding your spine to control the spine in a very good, like normal, neutral positions, typically painless positions, okay, your symptoms go away. And you teach your spine to stay in that position through good muscle control and good movement mechanics, okay, your back pain will decrease. Your activities will also decrease during this time period, okay? So, yeah, it's a lifestyle change for a little bit. Just is, okay? It's what it is. But your back pain goes away. Once your back pain goes away, then you learn how to move. You reinforce that movement with, good training and exercise. And guess what? You're back to normal life, okay? This is how I've been treating patients with back pain for quite a bit. Now, has everybody been successful in this program? No, but not all backs are created equal in regards to their injuries and what's going on. So just so you know, as a general premise, this is where I start people with cranky low backs. And the majority improve and get back to doing the things they want to be able to do. So, Josh, I hope this helps. Look at my YouTube channel. Anything that says rocking in it is most likely going to be a mobilization. We don't call it stretching, we call it mobilization. It looks a lot like a stretch. It's not stretching. You're not sitting there trying to crank one side and hold. Okay. You'll see things like open books. A lot of people are like, well, open book, that's rotation. You're doing low back rotation right there. I'm like, no. Look at the way we're doing it. The knee is driven up towards the chest. It's on top of a foam roller. You're never allowed to move it from there. Guess where the range of motion, or where your rotation is happening? Thoracic spine, not lumbar spine. Mid back, not low back. You'll see it. Look at the YouTube, John. If you have questions, reach out to me. We're happy to help. Yeah, that's it. 2 questions today. I appreciate it. Definitely things that we see a lot of, and I hope people get a lot out of this. The low back, Josh's question, I can't tell you how much I see this. And I can't tell you how much people just kind of deal with low back pain because they feel like this is what they have to do and they don't get results. And let me tell you this, like if you go to a clinician and you don't get results, you may need to try a different clinician. You may need to try another one. I know, I get it. It's a pain in the butt. Nobody wants to do that. It's cost, there's a lot of cost to it. Okay. But I can tell you this right now, you've got to find someone who understands your back, who understands what's going on, who understands what tissues are being essentially irritated or damaged. And you need to figure that out. And I think if you know those things, then you're going to give yourself the best chance at getting out of this back pain without having to do substantial means to do so, like surgery. Okay. So anyways, I appreciate everybody taking the time to come to the podcast and listen. Please rate and review on Apple podcasts or any other mean that you're listening to this podcast. I appreciate it. Please ask questions. That's how this podcast is driven, is through these questions. And tell your friends, and we'll get more people to the podcast, get more good questions, keep putting good information out there. And until next time, thanks. Hey everybody, just want to say thank you for listening to the Athletic Potential Podcast. If you do have questions for the podcast, please visit the website, www.athletic-potential.com/podcast. You'll find a button there to ask your question. Please input your information and your question, and we will answer any and all questions we get. We thank you again for listening. If you do get a chance, please rate and review the podcast. And until next time, thanks.